Why is diabetes a risk factor for stroke? Imagine your blood vessels as highways carrying blood to every part of your body, including your brain. When you have diabetes, especially if it's not well controlled, it can cause damage to these highways, making them more prone to blockages or even bursting. That's why diabetes significantly raises the risk of stroke. High blood sugar levels over time harm the lining of blood vessels, which is called the endothelium. When this lining gets damaged, it becomes less effective at keeping blood flowing smoothly. This damage promotes the buildup of fatty deposits called plaques inside the arteries, a process known as atherosclerosis. These plaques can narrow the arteries or break off and cause blockages, leading to ischemic strokes, which happen when blood flow to parts of the brain is cut off. Diabetes also makes the blood more likely to clot. Increased clotting means that blood can form clots more easily inside the blood vessels, which can block blood flow and cause a stroke. Additionally, diabetes causes microvascular damage, which affects small blood vessels in the brain. This damage can lead to small vessel strokes, known as lacunar strokes, or cause blood vessels to rupture, resulting in hemorrhagic strokes. Another important factor is that diabetes often occurs alongside other risk factors like high blood pressure, high cholesterol, obesity, and heart disease. When these conditions are present together, they multiply the risk of stroke even further. For example, high blood pressure can weaken blood vessels, making them more likely to rupture or become blocked. It's also worth noting that the risk of stroke increases with the duration of diabetes. The longer someone has diabetes, especially if blood sugar levels are poorly controlled, the higher their risk becomes. Studies show that after about 10 years of having diabetes, the risk of stroke can be about 3 times higher than in people without diabetes. Poor control of blood sugar, measured by a test called HbA1 degrees Celsius, is linked to worse outcomes if a stroke occurs. People with diabetes who do have a stroke tend to have more serious complications, including higher chances of disability, death, and recurrent strokes. This highlights how important it is to manage diabetes effectively. Good blood sugar control, along with managing other risk factors like blood pressure and cholesterol, can help lower the chances of having a stroke. Adopting a healthy lifestyle is also crucial. Eating a balanced diet, exercising regularly, quitting smoking, and maintaining a healthy weight all contribute to reducing stroke risk. Healthcare providers may prescribe medications that help control blood sugar and other risk factors, further lowering the chances of stroke. In summary, diabetes damages blood vessels, promotes clot formation, and often coexists with other conditions that increase stroke risk. Managing blood sugar levels and overall cardiovascular health is essential for preventing strokes and improving outcomes if one occurs. Always consult healthcare professionals for personalized advice and treatment options tailored to your specific health needs.